Bismillahirrahmanirrahim. Today we will have case quiz number 37. Case data: 73 years old male with diabetes mellitus, hypertension, and coronary artery disease, presented with fever, weakness, and dry cough lasting for 1 week. Also his wife had similar symptoms for 3 days. On examination, temperature was within normal, heart rate within normal, blood pressure 100/70 within normal, respiratory rate slightly increased 22 breaths per minute, and oxygen saturation 96%. Laboratory investigation show white BCs within normal, neutrophil within normal, lymphocytes within normal, and platelet also within normal. AST slightly elevated, ALT slightly elevated, creatinine within normal, CRB negative, D-dimer within normal. Nasopharyngeal and oropharyngeal swabs were negative for COVID-19. Chest computed tomography showed bilateral peripherally located ground glass opacities at the upper and lower lobes. The patient was diagnosed as suspected COVID, although the negative swab, and received ceftriaxone, hydroxychloroquine, and azithromycin. His cough, fever, and fatigue were improved gradually. He completed the 5-day course of hydroxychloroquine and azithromycin and 7-day course of ceftriaxone. 8 days after completion of treatment, swelling, redness, pain, and tenderness in the left first metatarsophalangeal, proximal, and distal interphalangeal joints were developed of the left foot, followed by 2 days later with similar finding in the right second proximal and distal interphalangeal foot joints. At the same time, the patient had markedly elevated CRB, ferritin, and D-dimer levels. Radiological examination of the affected joint revealed normal findings. Venous and arterial Doppler ultrasound imaging of bilateral lower extremities show no pathological signs. The screening laboratory tests for arthritis were unremarkable. Rheumatoid factor was negative, anti-CCP was negative, and uric acid level was within normal range. And finally, the patient responded well to non-steroidal anti-inflammatory drugs. So, what is the diagnosis? And as usual, we will leave you for 6 days, and the answer will be online on next Thursday. Wassalamu alaikum wa rahmatullahi wa barakatuh.